Causes of bad breath. How to avoid it. Bad breath is a common health problem which greatly affects the day-to-day activities of so many people. The offensive odor from the mouth is unpleasant to those who come in close contact with bad breathers. The problem will be doubled by psychological trauma leading to depression. The sufferers from this problem will be isolated from the society. This can even lead to marital disharmony. Literally speaking, all human beings are bad breathers. Oral cavity contains millions of anaerobic bacteria like fusobacterium and actinomyces, which acts on the protein of food materials and purifies them. This process results in the formation of offensive gases like hydrogen sulphide, methyl, mescaptan, cadaverin, skatol, putrescine, causing bad odor. If oral hygiene is not maintained properly, all will suffer from bad breath. Most of us control this by regular brushing, tongue cleaning and gargling. Even after maintaining cleanliness in the mouth, some individuals suffer from offensive smell due to various causes which has to be diagnosed and treated properly. Some common causes of bad breath. Poor oral hygiene. If oral hygiene is not maintained properly, the mouth becomes the seat for millions of bacteria which produce offensive gases by degrading the food debris. Bad breath is severe in those who do not brush their teeth regularly and clean their mouth after every food. Snacks taken in between meals can also produce bad breath because of improper cleaning. Bad breath is common in almost all people in the morning on waking. During sleep there is less production of saliva. Saliva has got some antibacterial properties which help to keep the mouth clean. Saliva contains oxygen molecules which is needed to make oral cavity aerobic. So the reduction in its quantity during sleep makes a favorable condition for anaerobic bacteria. Food habits. The main cause of bad smell is due to degradation of protein by the bacteria, and hence all food products rich in protein favors bad breath. Meat, fish, milk products, eggs, cakes, nuts, pear and etc. can cause bad breath. Some food articles can produce particular type of smell which may be unpleasant. Raw onion can produce typical bad smell. It is said that an apple a day keeps the doctor away, a raw onion a day keeps everybody away. Eating ground nuts can also produce bad smell. However, if proper cleaning is done, smell can be reduced irrespective of the nature of food. Irregularity in timing of food can also produce bad breath. Small food articles taken in between the meals can also produce bad smell. Biofilm. There is formation of a thin sticky coating called biofilm on the tongue and oral mucus. This coating is thick on the posterior aspect of the tongue where millions of gram-negative bacteria are seen. The thick coating on the tongue is always associated with bad breath. Even a thin biofilm can make anaerobic condition favorable for bacterial proliferation. Dental caries. This is a destructive process causing declassification with destruction of enamel and dentin, resulting in cavitization of the tooth. These are produced mainly by the lactobacilli. Food particles are deposited inside these cavities and are purified by the anaerobic bacteria, producing bad smell. Normal brushing will not remove the food debris easily, and hence they are purified completely. Caries are common in school-going children and in those who don't maintain proper oral hygiene. Calcium and vitamin deficiency can also predispose caries. Gingivitis. Gum is a mucous membrane with supporting connective tissue covering the tooth-bearing borders of the jaw. The main function of gum is protection. Gingivitis is the inflammation of the gum. Due to various causes, gum tissue get infected, resulting in swelling, pain and discharge. If the condition become worse, the infection spread towards periodontal area, leading to continuous discharge called pyorrhea. Sometimes the infection goes deep, producing alveolar abscess with discharge of pus. Infection can even reach the bone, causing osteomyelitis. All these conditions can produce offensive smell. Gum retraction. When the gums retract from the teeth, a gap is developed which will lodge food particles and cause bad breath. Dental plaques and tartar deposits. Plaques and tartar is deposited mainly in the gaps between the teeth and gum. This will provide shelter for the food debris and bacteria, causing bad breath. Ulcerative lesions and coatings. Almost all ulcerative lesions of the mouth are associated with bad breath. These lesions may be caused by bacteria, viruses, food allergies or due to autoimmune disorders. Aphthous ulcer is the commonest among ulcerative lesions. Others are herpes, fungal infections, Vincent angina, infectious mononucleosis, scarlet fever, diphtheria, drug reactions and etc. All fungal infections produce white coating candidiasis. It is considered as a precancerous condition. Offensive breath is associated with these conditions. Diseases of the salivary glands. Saliva is very useful to supply oxygen to all parts of the oral cavity. Even a thin film of coating called biofilm can provide an anaerobic condition in the mouth. Saliva can wet these layers and make an anaerobic condition which is unfavorable for the bacteria. Any condition which reduces the production of saliva can increase bacterial activity. Sometimes the salivary duct is obstructed by stones or tumors. Cancer of the salivary gland is associated with offensive odor. Tonsillitis. Tonsils are a pair of lymphoid tissues situated in the lateral wall of oropharynx. Inflammation of the tonsil is called tonsillitis. Bad breath is seen in both acute and chronic tonsillitis. Quinsy or peritonsillar abscess can also produce bad breath. Tobacco. Tobacco chewing is associated with bad breath. The smell of tobacco itself is unpleasant for others. Tobacco can irritate the mucous membrane and cause ulcers and coatings. Tartar is deposited on the teeth mainly near the gums. Smoking. Smokers always have bad smell. It can also produce lesions in the mouth and lungs causing bad breath. Smoking increases carbon dioxide in the oral cavity and reduces oxygen level, causing a favorable condition for bacteria. Diabetes mellitus. Mostly all diabetic patients suffer from bad breath. Coated tongue, ulcers and coatings in the mouth. Increased sugar level in tissues are responsible for bad breath. Bacterial growth in diabetic patient is very faster than non-diabetic individuals. Fevers. Bad breath is common in almost all fevers. Even an acute fever can produce bad breath. Severe bad breath is seen in typhoid. Other infectious diseases like tuberculosis, AIDS etc. produce bad smell. Fasting and dehydration. Dry mouth favors bacterial activity. So any condition which produces dryness in the mouth makes the breath offensive. Even though the food particles are known to produce bad breath, fasting can also produce the same. Production of saliva is also reduced during fasting. Chewing and swallowing also helps to keep the mouth clean. Note, the points mentioned in this article is for general information. Any person having bad breath should consult a qualified doctor. Don't forget to like our video.